Welcome back to the Live, Learn, and Play podcast. Here we talk about the people, places, and programs of Arkansas Children's. September is Childhood Cancer Awareness Month, and in today's episode, we visit with a mother for whom this topic is very personal. Tori Johnson is 4 years old, and her mother, Erin, joined us to talk about their family's journey with pediatric cancer. Now, here's Tori's mom. Welcome to the Live, Learn, and Play podcast. This is Jennifer Cobb. I am stepping in for Rebecca Brockman, who is on maternity leave. And we have another first for this episode. It's the first episode recorded at Arkansas Children's Northwest, our new hospital in Springdale. It opened in 2018, and it has already served a great purpose. We have an emergency room, we have specialty care clinics, we have outpatient and inpatient, and it's a wonderful resource for the 200,000 children that call this area of the state home. And today I am with Erin Johnson. She is the mother of Tori, who is an ACNW ambassador. She is a patient here at Arkansas Children's Northwest, and she is also the Color of Hope champion child this year. Color of Hope is the largest fundraising event for ACNW. So, Erin, thank you for being here.
Thank you for having me.
So let's start just by hearing a little bit about your family. Tell me who all is involved. I know Tori has an older sibling.
She does. Tori is 4, Sydney is 7. And they keep my husband, Matt, and I very busy.
I imagine those are busy ages for sure. So take us back. I understand that Tori was 9 months old when you were first alerted that something was wrong. Can you take us back to that moment, please?
You know, that day, a lot of it is a blur, but that morning is very clear when we look back on that. Started out as a very normal day. Probably just like most of Northwest Arkansas, both of us rushing around to get ready for work and getting kids ready to get to daycare. And I dropped her off at daycare, and I remember putting her on the floor with a little friend to play with. I turned around, said, "Bye, Tori. I'll see you this afternoon." And she waved, and I walked out the door. And about 10:15, I got a text and saying, "Hey, Tori's not acting right. She's a little fussy today." And as a mom, second child, and with a teething baby, you're kind of thinking, oh, okay, she's just having a bad day. We all have bad days. Well, things escalated pretty quickly, and they called and said, hey, something's going on with her. My husband picked her up around lunchtime. We knew right away there was something wrong. We didn't understand to what level, but we knew something was wrong. We got her to the pediatrician, who quickly got us to the ER. And a couple hours later, I was taking off on Angel 1 headed to Little Rock.
What was that feeling like when your physician came in and said, we can't treat you here, we need to get you to Arkansas Children's Hospital? What did that feel like?
It is one of the most surreal feelings to get on a helicopter with your child with tubes coming out. You can't hold her. When your child's sick, you want to hold them and you want to comfort them, and she had so many tubes and wires coming out of her, and she was completely out of it, and it's just a very helpless feeling as a parent. And I remember when we took off, it was a beautiful sunset over Northwest Arkansas, and I looked over at Tori and I was thinking, what are we doing? What am I doing on this helicopter with my 9-month-old while my husband and then 3-year-old and mom and dad are getting in a car to drive 3 hours to meet us? That's not our life. That's not normal.
So when you got to Little Rock and you landed at Arkansas Children's Hospital, Dr. Albert?
Mm-hmm. We thought she had a brain bleed, and Dr. Albert got her scans and knew otherwise. I didn't know otherwise until when Dr. Albert met us when we came off the helicopter pad. He starts asking all these history questions about cancer and family, and In my mind, I'm thinking, no, actually, my family has heart diseases and problems like cancer. No, why are you asking about cancer? And he brought me over to the desk and showed me her scan. And he's saying, you see this area? And I'm like, yeah. And he's like, that's not supposed to be there. And it's about the size of a tennis ball, it looks like. And he's explaining things, and he keeps saying tumor and different types of tumors. And I had to stop him, and I said, no, I'm sorry. You say tumor, and I think cancer. Like, what are we talking about? And he kind of just looked at me for a second. And I was like, oh, okay. And it was in that moment that I knew our lives were never going to be the same.
Right. And when you think about the size of a 9-month-old head and the tumor was the size of a tennis ball.
Yeah.
That's so massive.
She showed 0 signs of anything wrong until that day. We had a picture. We had gone to dinner the night before. We took a picture of her because she had some crazy hair. And I just thought it was funny. And I sent it to my sister. And I was like, what do I do with this? And she was looking up at the camera, eyes up. And for where the tumor was and the size, she should have never have been able to do that. There were 0 indications that something was wrong.
That is so frightening for your family. So you're in Little Rock, your husband, your daughter, your parents arrive. And how soon was the surgery? How soon did Dr. Albert operate?
Well, as soon as when we were talking and I started asking questions, he said, first things first, right now we need to save her tonight. I need to go do this surgery and drain fluid from her head, from where the tumor was bleeding out. And so right then and there, he went and did that surgery. And my in-laws live in Conway, so they had already made it to Little Rock, and they were waiting for me in the PICU when I got there. And so we waited for Matt and Cindy and everybody else to get there and for Dr. Albert to finish that first surgery. So that was on a Tuesday. And then Friday is when Dr. Albert wanted to biopsy the tumor. And that was the goal of that surgery. The only thing he wanted to do was biopsy, get enough of it to make sure that they could correctly identify what type of cancer it is. They had an idea, but they needed the pathology lab to confirm it, and get her through the surgery. Where it was very dangerous. It was on the back side of her brain. It wasn't on the stem. It was just kind of like right above it. And there was that chance that it could start bleeding out and she may not make it.
So the diagnosis was what?
ATRT, which is atypical teratoid rhabdoid tumor. Yeah.
It's amazing the things you learn to pronounce,
right?
Correct?
Yes. Funny enough, I sell cheese for a living, not medical, and I am very well versed these days in medical terminology, more than I want to be.
Right. More than you want to be. You've joined a club that no one ever wants to join.
Yeah. You think when you're having kids, you're going to be a soccer mom or a cheer mom, and cancer mom is never a title you want.
No, it's not. It's an exclusive club no one wants to join for sure. So you get the diagnosis, and what were the conversations around prognosis at that point?
Prior to Dr. Albert being able to completely remove the tumor, that in itself was a miracle. Because like I said, all he wanted to do was be able to biopsy it. When he got in there, he was able to completely remove it.
Oh my goodness. So he did that at the same time as the biopsy.
Yes.
Wow.
So when he went in and he biopsied it, the tumor just kept coming away, and he felt comfortable with everything and her vitals. And so he just kept going and going, and he was able to get 100% resection.
That's amazing.
And with the type of cancer that she had, it's so aggressive that typically the prognosis is very different for a complete resection and not being able to. It is very hard, even with the strongest treatments that is out there right now, to be able to keep up with the growth rate of these tumors.
So he removes the entire tumor, which is rare. Then did she still have to have chemo and radiation?
Yes.
She still went through that because
of the type of cancer, the microscopic cells that could still be left in the margins can quickly turn into full-size tumors again. And for that reason, we still had to go through a treatment. So at that point, the oncology team at Arkansas Children's took us through a couple different protocols, giving us the pros and the cons and how it all worked. And then we basically had to decide which route we wanted to go. Obviously, they gave us guidance and gave us their medical opinions. But at the end of the day, Matt and I had to look each other in the eye and say, what do you want to do?
The oncology team then gave you a few options for a course of treatment for Tori. You and your husband had to decide between the two of you which path to pursue. Tell me about those conversations.
They are conversations that you would never even dream of having with your spouse. Everybody processes differently in general, but to have to try to process what's happening to your baby individually, but then also as a couple, and then also as a caregiver, there's a lot of different aspects that went into that. And we are very analytical people. We broke down the protocols and the pros and cons and side effects and time, all of it. And then at the end of the day, we said, what is our best chance at getting her healthy and keeping her healthy? And it was a newer protocol that had just kind of finished with clinical trials and studies. And we said, that's the route we're going to go. And we looked each other in the eye and we said, we are making the best decision we can make with the information that we have right now. And that's all we can do. And we said, once we made that decision, we weren't going to look back. We would never question the decisions we made, and we were making them together.
Let's talk a little bit about the impact that it had on your family. The diagnosis, you mentioned it's hard to process the information as an individual. Then you have the level of processing it as a couple, processing it as a mother. But you also have Sydney. So let's talk for a little bit about the impact on your family unit to have Tori undergoing this treatment in Little Rock, 3 hours away from home.
The treatment piece of it is devastating. It's agonizing going through all that, but in a way there's a plan. You know what's going to come first, what's going to come next. Now, how her body responds and all that can change that, but we had a plan in place. And there is no plan in place to have to try to explain a cancer diagnosis to a 3-year-old. You hear moms say all the time, especially first-time moms, they send me home from the hospital with this baby and all of a sudden I'm just supposed to be able to take care of them and there's no handbook or anything. Well, there's really no handbook when it comes to this. And it is gut-wrenching having to try to decide, stay at the hospital with my sick child who needs me, or go home and be with my well child who I haven't seen in 2 weeks, who doesn't understand why mommy and daddy aren't home, why she's having to go to grandma and papa's house or so-and-so's house to stay for a night or two, and why her new sister that she just learned that she had to share with is no longer there. And because of the diagnosis, we couldn't say, hey, baby, it's going to be okay. Tori's going to be home in 2 weeks or 3 weeks. Those were promises we couldn't make. And we decided that we were going to be honest with her, obviously not expose her to things that were way above her head, but baby sister is sick and we're all going to take care of her and we're just going to have to try to come together. And luckily we have a great support system in my parents and his parents, and we developed a plan of who would be at the hospital when, and always try to keep Matt or I with Sydney at all times. Obviously, at first, before everything, we had family that stepped in. But during treatment, we really tried to keep at least one of us with Sydney to try to keep some sort of normalcy and keep her anxiety down because she's 3. Right. She wants mom and dad. And there's nothing more gut-wrenching than knowing you're leaving the hospital to drive from Little Rock to Northwest Arkansas because it's your time to switch out. And I remember lingering in Tori's room and just touching her face and touching her arm because you don't know how that next day is going to turn. The way cancer treatments go, one day you're fine, one day you're not. And you're so scared that something's going to happen the minute you leave the hospital. And I remember pulling out of the parking lot, and I think it was Russellville before I ever stopped crying. And then you feel so guilty as a mom because you're crying, but yet you're getting to go see your child that you haven't seen in a couple of weeks. And you miss her terribly. And it's all the things that you thought your family life was going to be with 2 kids. It's not. And it's frustrating. And I'm a doer, and I'm a planner, and I'm a control freak, I guess you could call me. And I had no control over anything other than when I was with Tori, she had me 100%. And Sydney, I was making my time with her as happy as it could be.
And how long was treatment? How long was your family living this way?
Nightmare. We had 5 high-dose rounds of chemo. She had 3 stem cell transplants and 6 weeks of radiation. All of that was a course of 9 months, which in the grand scheme of things, compared to some other treatments, not that bad. For us, it seemed like an eternity.
So it began at 9 months, and by the time it was finished, she was 18 months old. What effect did it have on her, on all those milestones you're supposed to hit between 9 and 18 months?
Yeah. Developmentally, she's delayed. And she's in about 8 hours of therapy a week right now. And we're dealing with everything from PT to OT, speech, even something simple as eating. The chemos have numbed some of her senses in her tongue. So she only chews food on one side of her mouth, which affects how she talks and how she eats and things you don't even think of. It's just our body reaction to be able to just chew correctly and chew from side to side that she can't do, that she's trying to learn to do. And she's been in all these therapies and she's getting there and she's progressing and it's fantastic, but it's still hard now that she's getting older to see her when you compare her to a now 4-year-old, you realize how far behind she is. As parents, we're like, oh, we don't care. It's a miracle she's here. We love she's here. She's doing phenomenal. But for her, for a parent wanting nothing but the best for their kids, it's a tough pill to swallow. And now she's getting to the point where she knows she's behind. She's starting to ask questions.
So let's go back to 18 months old. Her treatment is done. At what point, I'm trying to do the math on the years, but at what point did AC&W open and you were able to start getting some of her services and care here?
So AC&W opened up in 2018, and for her schedule of scans, we were able to have her first scan here in January.
That's wonderful.
And to say it's a game changer is the understatement of the year. It was normally a 3-hour drive. It was waiting because you have appointments. She couldn't eat because she so little. You have to do sedation. So explaining to a 3-year-old, no, you can't eat until later in the afternoon because you have a scan at noon was impossible. We would usually have to leave Sydney with my mom and my dad or go up the night before or drive early the next morning. Having ACNW here, we all get up in the morning. Tori still doesn't eat, but she doesn't really kind of notice it at that point because we drop Sydney off at school. Bye, Sydney. Have a good day. And we drive to ACNW. We have her scan. She wakes up. She eats. We're home by lunch. We go and pick Sydney up as a family. Most times, Sydney doesn't even know she has a scan that day. We're just going to the hospital. So that piece of it is just, it's life-changing. Because the anxiety you have as a parent anyway, even if she's not showing signs of anything being wrong, you still always wonder, what if? Is today going to be that day? Because the day it happened, we didn't think anything was wrong.
So you mentioned, so she's able to come here and get her scans, but you also were telling me about a scary emergency room visit.
Yeah.
So you've also come through the emergency room here. Can you talk a little bit about that?
A couple months back, she started having seizures, and we were able to see neurology here. So we were already in treatment with them, and we were doing follow-ups, and we were monitoring them, but it got really bad one day, and they had to rush her to the ER because the emergency meds that we had on hand weren't getting her out of the seizures. I was in California on a business trip, and my husband calls me and says, "Hey, we're going to ACNW. I'll call you. I'll call you when I get there. I don't know what's going on." We are so close with our teams here, and they've made themselves available that I call the hospital as a mom, as a doer. I'm like, "Can I speak to oncology?" And, Tracy, Dr. Taylor's nurse, I get her on the phone. I say, "Hey, Tori's coming in. This is what's happening." She says, "Dr. Saylor's here." Tori gets here. They check her in. Dr. Saylor's goes down and evaluates her himself. They do a scan. And then by the time I get back from California, when I land, we're getting a phone call from Dr. Saylor saying, "Hey, the seizures are not being caused by a relapse. It is all clear. We still need to figure out the seizures, but it is not cancer or treatment related." So in less than 24 hours, all of that is resolved. The environment's so warm and welcoming, it's not a scary place for them to come into. It wasn't a long drive or a helicopter ride or anything scary in that sense. So when they hear we're going to the hospital, it's not a scary thing for them. It's not a scary place. And that's a huge peace of mind for a parent.
Can you speak to, do you have experience or can you compare experiences in an adult hospital that has pediatric care but is not 100% focused on children versus bringing your children here to a pediatric facility where the experts and the whole facility is built around the needs of the child and the family?
When Tori first got sick, when we got her to the pediatrician and they told us to go to the ER didn't have the supplies to try to intubate a 9-month-old baby. She was too small. The medicines that you give a child in a critical situation at 9 months old is based on weight. But a lot of adult hospitals don't know those ratios right off the top of their heads. Nothing against them. They're, primarily dealing with adults. So when we got to the ER, they had to call Arkansas Children's right away. So everything they were doing, they were on the phone with Arkansas Children's. Versus if the hospital had been here, this would have been our first stop. How much time could have been saved? And granted, everything worked out on our end. And so we are thankful for that. And we are thankful for all the care. But it's a big difference. And not only the care, the compassion. The nurses here, their ability to calm a child, it's amazing. It's thank you doesn't do it. You look at a nurse and you say thank you and you're like, "I'm sorry, that's really lame," because it's not, it isn't. You're so scared as a parent, and I don't care how calm I like to think I can be. the way that a nurse, these nurses come in, or social work comes in when they know they're going to have to do a stick, and they know the routine of offering different ways to distract them and not make it so scary. It's a cool sight to see.
So tell us about how she's doing now. All her scans continue to be clear. Tell me about your everyday now. I've met her, and man, she is a charmer. She is full of energy.
Oh, she is a firecracker. That's kind of my one word to describe her. And, she loves life. She loves to love on people. And her greatest joy is seeing other people happy. And that is Tori. If she sees a crying baby in a restaurant or upset kid, Mommy, what's wrong? Can I go hug them? I'm like, probably not appropriate, but that's just her personality. She has no fear when it comes, and all she wants to do is love people and everybody get along and be happy. And that's kind of how we live life. We are positive, and we know all the statistics. And while they scare my mama heart at night sometimes, during the day, her and Sydney are normal 7 and 4-year-olds. They're loving 1 minute, and then they're fighting over a stuffed unicorn the next minute.
That's
It's just
something that I'm sure during treatment and during those scary, scary months you thought might not ever happen.
That was the hardest thing for me to come to terms with. Separating them not being able to be together because of having to keep Tori safe with germs and all of that, with flu restriction that was for her own good, and we understood it. But when I had Tori, I had 2 girls, and I have 3 sisters, and we're best friends. And so the idea of thinking that they might not have that was probably the hardest thing, because it would be unbearable to lose Tori, the innocence and the love and bond that it would also take away from Sydney. The physical pain it would just put in my heart was the part that I couldn't handle. And I would just sit there at night and just pray that was not going to be their journey. That while I get, I might not deserve to be Tori's mom, but Sydney is this innocent 3-year-old child that deserves her sister, that deserves to get to grow up with that built-in friend. And even when they fight, it doesn't matter, because she is Tori's biggest protector. She will defend Tori. She helps Tori in every sense of the way. And watching that now and thinking about what could have been, I mean, you can tell
it's hard. It's hard to think about it. And thankfully you don't have to.
That's what we say.
Right. Well, before we wrap up, I want to end on a fun, happy note. Tell me about Tori's special friend who wore a special uniform and how they met. Y'all were here for a clinic visit? Is that what happened when you met Derek?
Yes, we were here, and the Razorbacks were here, and we were in the family room, and they came in and started coloring. And in true Tori fashion, she told him he was coloring incorrectly and with the wrong color. And so he said, okay, well, come here. And she's like, can I sit in your lap? And he said, come on. They were hilarious to see these big old football players getting bossed around by these little kids. And they were fantastic with them. And right away, Tori and Derek just became best friends. She invited him over, wanted to have him over for dinner, didn't understand why he couldn't come swimming at our house. I mean, you name it, she was ready for them to go to school together, the whole 9 yards.
That's so cute. And so he thought about her too. He felt the exact same way, as I understand it, and even asked Coach if she could come to a practice.
what happened is they had a speaker come talk to the team about giving back and in football, there's more than football and being more than just a football player. And afterwards, he went up to Coach and he said, hey, when we went to the hospital, I became friends with this little girl, but I have no idea how to find out if she's okay or what's going on with her. And so, through all the right connections, they got in touch with us, and then they had us surprise him at practice. So he thought he was in trouble because after their team meeting, they said, hey, we need to see you in Coach's office. And when they brought him in, there was Tori, and they let him go out and run on the practice field with them. She stretched with them and warmed up, and she threw the football. The football was about the same size as her.
Yeah.
She thought that was hers. They, of course, sent that ball home with her.
Of course.
And she will still go in at night and check on her because it normally sits on her little shelf in her room. But we'll go in there, and there's Tori. And, oh, wait, she's got the football she's sleeping with as well. So
that's so cute.
It's super cute.
That's so cute.
That's her football man, as she calls him.
The football man. I love that. Well, that'll be a special bond for them forever, I'm sure. And it's a really neat relationship that we've established with the Razorback football team. They come here and have that big impact on a lot of our patients.
I think it's great for all of them.
Thank you for being here.
Thank you.
Thank you for sharing your family. I know as an ACNW ambassador family, we call on you a lot to share your story. It's just one that is really heartwarming. So thank you for your service.
Thank you.
And we are so grateful for you and for your family and for the prognosis on Tori.
Thank you. We are happy to do it.
What an emotional story. I'm so grateful that Erin joined us to share her family's journey with childhood cancer. And while Tori is now doing very well, there's still more than 100 children every year in Arkansas that are diagnosed with cancer, and more than 90% of them are treated at Arkansas Children's Hospital and Arkansas Children's Northwest. That's why Arkansas Children's is going gold in September for Cancer Awareness Month. And if you are so inclined, we sure could use your support. You can make a gift today in support of pediatric cancer research and treatment at giving.archildrens.org. We'll be back later this month with 2 more episodes of the Live, Learn, and Play podcast. We have 2 teenagers who are pediatric cancer survivors, and they joined us to share their stories in their own words. In the meantime, please rate and review us wherever you get your podcasts, and we'll see you soon.